Now to a story about medical technology on a mission.
For one Austin pastor, regaining the use of his hip is helping him climb to new heights, and help others at the same time. KVUE's Jim Bergamo is here with us, and tonight's Health Feed. Jim?
Well, Terry, Tyler, Pastor John Short left this morning for Africa, but this journey really began in England, specifically Birmingham, where scientists created the technology for hip resurfacing decades ago. But the materials to make that technology work long-term have only been developed in the last few years. Getting a picture taken before an international trip is fairly common.
That's great. Okay, we're all done.
But John Short isn't getting a passport photo, he's getting an x-ray.
In my late 20s, I was nearly bone on bone on my left hip.
The pain got worse as he got older.
If someone tripped over my foot, it just sent me into the stratosphere. The pain would just shoot up in my spine.
John had resigned himself to this is all part of getting older.
How are you? It's good to see you.
It's really good to see you.
Then he met Randall Schultz at Texas Orthopedics and learned about Birmingham hip resurfacing.
So resurfacing means we are literally just putting a new surface on top of the ball, which has lost its cartilage coating.
Schultz says hip resurfacing allows patients to preserve more of their own bone. Unlike a total hip replacement where the ball is removed from the top of the thigh bone,
The resurfacing, we're actually leaving their bone in place and putting a cap on top of the diseased arthritic ball, and therefore would keep more of their own bone if they need to have surgery later.
It's been nearly 5 years since John had the procedure. He says he feels so healthy he's ready to take it to the next level, the nearly 20,000-foot level of Mount Kilimanjaro. As one of the pastors at Gateway Church, he says it's important to take ministry outside the four walls for things like this year's Operation Mobilization, the Freedom Climb. Its goal is to help thwart human trafficking that often leads young women into the sex slave industry.
And it's representative of what it takes for a woman, a girl, or a young lady to actually climb out of her situation.
John's hiked Big Bend and Mount Wheeler in New Mexico, but not Mount Kilimanjaro. But thanks to hip resurfacing and a mission to help others, he knows he's ready.
So now I have an active lifestyle and I can do this, and because I have a heart to help these women across the world get out of their situation.
Doctors say men under the age of 60 are the best candidates for hip resurfacing. By preserving the bone with this procedure, more healthy bone will be available for a total hip replacement later in life. Jim Bergamo, KVUE News.